Trevor and Marie Cox had private health insurance with Bupa for decades.
That one! Can't do that.
When Marie slipped on a nature strip, they believed her shoulder replacement would be covered.
If you hit a piece of violet crumble with a hammer, then you would probably get what was in my, what was left of my shoulder socket.
On the drive to hospital, they learned Bupa wouldn't pay, so they borrowed $30,000 off friends.
And then we had to remortgage our house to pay everyone back.
Oh, so there you are.
It was just cruel. I'm just a little fish and, you know, they make so much money.
Gold, silver, bronze.
The Coxes are among 360,000 Australians who've dropped gold cover in the past 5 years as premiums spiralled. Joint replacements were taken off their policy.
There's been huge inflation in the cost of gold hospital cover because it only covers bad risks.
If you're taking silver or bronze level, the health insurer is still making a mozza off the back of your premiums, right? But if you do get sick, there's a whole list of exclusions that they don't have to pay for.
We have here what we're not covered for.
Their new Silver Plus policy also didn't have accident inclusion cover, which could have kicked in. The OBC has found accident add-ons are poorly understood because of overlap between state-based car and workplace insurance schemes. And their absence isn't always clearly identified on policy documents.
If you're not covered by accident, why do you bother having health insurance?
You shouldn't need a lawyer to understand your insurance policy. These loopholes need to be closed, and they need to be closed before the premiums go up again.
Nearly 3/4 of joint replacements are done in the private system. Orthopaedic surgeons say stories like Marie's are becoming more common.
Lots of people are getting a surprise. They find that they are not covered for that particular procedure, and it comes as a shock to them.
There are probably ways in which the health funds can do better in explaining what accident cover actually entails, but any product that you buy that's less than top hospital cover will have exclusions.
The Coxes are among those questioning the value of private health insurance, with the federal government approving an average 4.41% premium rise from April. Customers with the big four insurers, HCF, Bupa, Medibank and NIB, will see hikes between 4 and 5.5%. The Health Minister says this year's rise has had to consider the viability of private hospitals struggling with insurer payments.
We know this is going to be tough for households. We've also been clear with insurers that we expect them to pay more of their income to private hospitals.
This is just another burden on families when they're already doing it tough and when they can least afford it.
A CEO forum convened by the Health Minister has spent the past 12 months trying to iron out problems in the industry following high-profile hospital closures. Private hospitals are calling for a mandatory code of conduct for insurers, while others want a floor price for medical treatments and an independent regulator.
We're seeing maternity units, mental health units, regional units close. It's decreasing the value proposition of private health insurance because that patient can't access private healthcare.
The industry wants a review of gold to basic tier pricing, but rejects the need for a new regulator.
That would be a waste of money, and the current regulators are doing a more than thorough job.
Bupa says the couple simply weren't covered, but understood it was upsetting.
Yeah, it's always sort of skewed to benefit them and not us.
I get upset. It's not fair.
For some policyholders, the system is still too complex.